So there were some important votes that took place at the June Advisory Committee on Immunization Practices, or ACIP meeting. Can you provide some insight on the vote regarding pneumococcal vaccination and its impact on patients and providers?
So the pneumococcal vaccination is a little complicated, so let me give you some background. We're going to be talking about pneumococcal vaccination for people aged 65 and older. The past current recommendation was that everyone who reached the age of 65 should receive pneumococcal vaccine using both vaccines. First, pneumococcal PCV13 conjugate vaccine, followed about a year later with pneumococcal polysaccharide vaccine. The issue had to do with the use of conjugate vaccine. You see, conjugate vaccine is used routinely in children. It's been enormously successful. And what happens when you give the vaccine to children is that it also removes pneumococcal carriage. So they don't give those pneumococcal types to their elders, and therefore the elders benefit indirectly, sort of herd immunity, herd protection. So older persons also, even though they were not vaccinated directly, had a profound diminution in the occurrence of serious pneumococcal disease caused by the 13 serotypes in PCV13. So, after that lead-in, the question before the House was, should we continue to use PCV13? Is that necessary? There was an elaborate discussion on both sides of the issue, too detailed to get in now, but the bottom line was that they decided to remove the routine recommendation of PCV13, but they said, and remember, this is for immunocompetent people, they said there's shared clinical decision making. Doctors and patients can decide whether to receive that vaccine. Now, let me emphasize that if you reach age 65, and if you're immunocompromised or you have any number of risk factors for invasive pneumococcal disease, if you're a smoker, if you have diabetes and the like, then you should still get PCV13 and pneumococcal polysaccharide vaccine. So the ACIP's recommendation for shared clinical decision-making only refers to those patients reaching age 65 who are immunocompetent. We might pause and consider that actually, once you reach age 65, there's already a very substantial proportion of the population that has a risk factor for pneumococcal vaccination or is immunocompromised. And actually, that proportion of the population increases, obviously, with increasing age. So many of us over age 65 have an underlying chronic disease. It remains to be seen how this kind of step back, we might call it, by the ACIP is going to be implemented, and whether a lot of doctors say, well, in order to make sure I give it to all the people who deserve it, I'll just continue to give it to everyone. This remains to be seen down the road.